Hi everyone, it's Lachlan from the Learning and Literacy Clinic here, and today I am talking about two fairly well-known but fairly misunderstood conditions, which are ADHD and dyslexia. So to start, let's talk about a bit of the research and imagine a practical scenario. Let's say we have 100 people with ADHD and 100 people with dyslexia, all standing out in a big field next to each other. If you looked into those groups further, what you would actually see is that the likelihood of someone having both of those conditions, so they've got ADHD and dyslexia or vice versa, the rate that that happens is up to 45%. That seems to be the max that the research shows, but 45% comorbidity. Now, when you think about it like that, these two groups aren't actually really two separate groups of people. They're one large, interconnected, overlapping group of people that either have both conditions or sometimes, perhaps more strangely, they only have one of the conditions, but they have a lot of signs that look like the other condition. Why is it that conditions with attention concentration problems look like a condition that has reading problems as its core symptom? If you have a student with dyslexia, and of course the core problem is that they're having trouble with reading and often writing as well, and they are being asked to do reading and writing activities all day, every day, 6, 7, 8 hours a day, they're obviously going to have a lot of trouble with that. And that can look like stopping doing the work, not being able to do the work. If you can't do the work and you're there for hours and hours a day, you're probably going to start thinking about some other stuff or doing some other stuff. You're going to appear distracted. You're going to be daydreaming. Maybe you are talking to your friends. Maybe you're doing unrelated activities. Maybe you've also got a lot of feelings of shame, anxiety, anger, stress, and that can result in externalizing problems, behaviors of concern. All those things would make a lot of sense. But of course, if I told you that the kid was not focusing, not completing their work, not initiating tasks, distracting other students, having behavioral concerns in the classroom, if I just listed those things for you, the first thing that's probably going to pop into your head, whether you're a clinician or a teacher or a parent, is probably going to be ADHD. Now, of course, again, it was the dyslexia that was the root cause of this problem. But on the surface, if we're just looking externally, it can look a lot like ADHD. How do we as clinicians actually tease them apart? Well, there's a few different things you have to do. One of the things, of course, is you need a really complex medical and developmental history. You want to start by asking, do they already have an ADHD diagnosis or a dyslexia diagnosis or something else like that that could explain the symptoms we're seeing? We also want to get information from lots of sources, so home and the teachers and the clinical tests, etc., because if the problems are only happening in one specific setting, that might be unusual as opposed to the problems happening everywhere. And another really important thing is the idea of response to intervention. So if you've been Googling dyslexia, for example, you may see that this idea of needing 6 months of therapy. Technically, it doesn't have to be exactly 6 months, but usually it's around that amount. Anyway, that's a good dose of intervention for us to get a sense of what's going on. But why do we have to do that in the first place? If you have dyslexia, what we are basically saying is that you have an impairment in your underlying ability to learn how to read. So if we do 6 months, 12 months, whatever, of therapy with someone with dyslexia, what you will see is a slow, steady, but hard-earned rate of improvement. Now that makes sense because we're doing everything right. We're doing the gold standard therapy, but this student just literally has trouble learning these skills. That's the diagnosis. So they're not improving rapidly. So you do your therapy, you see a very slow, hard-earned response, and you go, okay, that looks like a learning disorder to me. And that makes you more confident about it. If you have only ADHD, for example, and you do not also have dyslexia, but if that's the case and you do gold standard, really intensive therapy, they are going to rapidly start improving in their reading and writing skills on a rapid trajectory up to where they were expected to be. Now, of course, if you're rapidly improving in reading and writing with some instruction, you don't have an impairment in your ability to learn how to read and write, do you? You were behind for some reason, quite possibly the ADHD, possibly other factors, but you seem to be catching up fine. So we would probably be pretty confident to rule out dyslexia in that case. Now, of course, it can be far more murky than that. There's a lot of other factors that can come into play at one time, and we don't always see really clear patterns of slow or rapid progress. So you do have to assess a lot of variables at once, but that is the general picture of what we are looking for. Now, of course, if you're worried that you or your child or one of your students in your class has dyslexia, then make sure that they get assessed by a clinic that actually specializes in learning disorders so that you can get the right treatments and the right diagnosis. Obviously, if you get the wrong treatment, you're going to be wasting a lot of time. And that's why we often see kids who apparently have ADHD and they're trying ADHD medications, and strangely, they're not responding. And it's not that surprising because ADHD medications don't cure dyslexia. So we have to keep that in mind. If we have the wrong diagnosis, we may have a very wrong treatment. Obviously, it's not that simple. There can be a lot of other things that are at play there in terms of medication responses, but important to keep that in mind. Now, if you have any questions about this or you want to investigate further, please feel free to reach out anytime. We would be happy to chat. Thanks.